The Ministry of Health has assured Kenyans that the country remains fully prepared to respond to any possible Ebola outbreak following renewed regional concerns of rising numbers and fatalities. Uganda already closed its borders with Democratic Republic of Congo to curb the fast-spreading disease. Medical Services Principal Secretary Dr. Oluga defended the country's readiness to participate in global Ebola response efforts. Dr. Oluga said Kenya will not retreat from its international health obligations, affirming that the country's foremost duty lies in protecting its citizens.
The government has moved to reassure Kenyans over the country's preparedness to deal with Ebola and other infectious disease outbreaks. Speaking on the country's readiness, Medical Service Principal Secretary Dr. Oluga said Kenya has put in place strong emergency response systems, citing years of experience in successfully handling global health threats, including COVID-19.
We, as the Ministry of Health, are taking all measures to ensure that we protect Kenyans and we protect Kenya from international health outbreaks. And so far, we are dealing with an international public health outbreak for Ebola that is in DRC.
According to the ministry, more than 2,200 healthcare workers have already been trained in Ebola response and infectious disease case management, noting that Kenya currently has one of the highest isolation capacity in the region.
2,200 healthcare workers have been trained. But you also know that Kenya has been at the forefront of international response. In 2015, the country that was relied upon by the world to send 157 experts to help Sierra Leone contain and tackle Ebola from 2014 all the way to 2016.
On the other hand, Principal Secretary for Public Health Mary Muthoni emphasized on laboratory preparedness, saying Kenya Medical Research Institute KEMRI remains one of the world's leading infectious disease laboratories, with neighboring countries continuing to rely on Kenya for testing and confirmation of Ebola samples.
Our labs have really been enhanced. You know, in 2019, 2020, during COVID, we could send our samples as far as South Africa. That is how low we were. But today, our labs have the capacity to test and give results within 6 hours, 6 to 8 hours.
The remarks come amid reports of a diplomatic and health coordination standoff involving Kenyan officials in Uganda over cross-border Ebola containment measures and movement restrictions linked to surveillance operations. This comes as the US announced enhanced travel screening, entry restrictions, and public health measures to prevent Ebola virus disease from entering the country amid ongoing outbreaks in the East and Central Africa. Noel Ongeso for Prime Edition.